Because there must be a reason why. There must be a reason why people are avoiding. But I was your neighbor about a year ago. I was the Minister for Defense, and I visited more dangerous places, both inside our country and outside our country. I visited the front lines where our troops protect our country. So, but it's good that I have. I thought I was getting late to have come here. So I was wondering why am I not going to Pharmacy and Poison Board. But there was a very good reason, because I was trying to make sure that there is a very competent chairman and a competent board and do a few things. So I am in the right place now this morning. Principal Secretary, Public Health and Professional Standards. I will not say public service. And I've seen many people saying public service, even in our ministry. We should not allow that. The board chair, Dr. Munyo, the acting CEO and the management, the good staff of Pharmacy and Poison Board. Good morning, good afternoon. I think it's a good day to join you here on my first official visit to Pharmacy and Poison Board. And I really want to appreciate the work of the board and its leadership and every member of our staff. Your work behind the scene is the one that safeguards the health of our nation and is felt across Kenya. That I want to tell you this morning. And the Pharmacy and Poison Board is not simply an administrative body. From where I sit and where we sit in the Ministry of Health, the Pharmacy and Poison Board is a guardian of quality, safety, and trust in our healthcare system, carrying one of the most important mandates, and that is to protect and promote public health. Since assuming office, I have followed your work closely, particularly your efforts towards achieving the World Health Organization Maturity Level 3. And I know you're working diligently on the institutional development plans arising from the last assessment which was done. But when I went to Geneva and I met the Director General of WHO, who is an old friend of mine because he has been around here. He is from Ethiopia and he has been the longest serving foreign minister in our region, who I know him personally. He told me the problem of Kenya not attaining ML3 was its own Ministry of Health officials. Even when he sent team, the teams were not received at MOH, and they could go back when they were not happy. So today I'm here to confirm that Kenya must achieve WHO ML3, and it's not for prestige, but because it's going to strengthen our regulatory oversight. It will open markets, it will boost investor confidence, and above all, it will support our local manufacturing ambition. So I look forward to returning next year to celebrate this milestone with you. So whether we like it or not, by next year, March, April, we must receive ML3. Even if I might not be here, I'll still make sure that whoever will come, we must achieve it. It's a presidential directive. So the president has given firm instruction that we must have ML3 by early next year. And WHO are ready, they're willing, they're committed. And I'm sure Pharmacy and Poison Board top leadership and staff are ready. I am also aware that we have staffing gaps that may have challenge on your progress. As a ministry, we are going to address that. Of course, we have the World Bank funded project, Health Emergency Preparedness, Response and Resilience. When I came, there were many hurdles to that project. I had a meeting with the World Bank, And I'm sure that World Bank project now is on course, and I have told the acting CEO and the board chair that now we should start hiring the 45 officers in order to strengthen our PPB regulatory capacity. We will also talk to the National Treasury to secure further approval so to increase our numbers. But I want to issue the following directives, you good people. Because the Pharmacy and Poison Board, KEMSA, Kenyatta National Hospital, NQCL, I'll continue. There are 5 institutions I have been given express direction that they must change, and they must change for the better. So I will be coming here. If the other ministers are not coming, you'll see me very often here. But I use the mosque around here to pray. Every time I come to the mosque, I'll pass by here. The 2 institutions that are very close to the mosque is Kenya Medical Practitioners Dentists Council. I've told Dr. Kariuki, and I'll tell Dr. Mohammed. You'll find me just walking in here. Because both of these institutions here are very, very important in the delivery of the universal health coverage. And that's why I'll talk later why we have the role you'll interplay with SHA and Digital Health Agency. So, chairman and board members and management, you must fully comply with the law and take decisive regulatory action against any individual or entity that endangers the life, the health, and the safety of Kenyans. You must immediately rid the Kenyan market of all substandard, falsified, poor quality, counterfeit, and unregistered medicines. Umenisikia our staff. Yes. And this is not an option. So if you don't want to implement these directives, then you have to look for another place. Any individual, any premises, any establishment, any entity which is involved in the distribution and sale of these illegal products must be arrested, prosecuted. Action must be taken against those in charge of those premises, but also against their directors. Who is in charge of registration of pharmacists? Yeah. In the next 2 weeks, the way Dr. Masi Mangange of SHA is closing health facilities who are involved in fraud, you must, please have a seat. I must hear you closing pharmacists. You must close pharmacists who are involved in this thing. And I must get the list. If you want me to gazette, I will gazette it with my signature. Yeah. Anybody selling Kenyans, counterfeit, unregulated medicine and drugs, you not only deal with them and prosecute them, you must close that pharmacy. And if we don't hear that, then nothing is going on. CEO, as I told you earlier, you know, the week when there's no noise in the health sector is the week that I'm not around. Even the president knows. He tells me if there's no noise, you're not working, even if you have become part of the cartel. So next week I must hear pharmacists being closed in this country. If I don't hear, then you guys who are in charge, you are part of that. Parallel importation must strictly adhere to the Pharmacy and Poison Board. You have got something called Parallel Imported Medicinal Substance Rules of 2019. Any non-compliant products or actors must be removed from the market without delay, and we must implement these rules to their full extent and eliminate from the market any product or entities that fail to meet the required standard. Kenya must be as must not be a safe haven for falsified, substandard health products. And I direct you today to enforce suspension, closure, seizure, prosecution of every enforcement measure provided for in the law. And this includes ensuring timely renewal of product registration despite any pushback. Who is in charge of inspectorate here? Yeah. There's a serious problem with your inspectors. If they are sitting here, they can raise their hands. How many inspectors are here? Raise up your hands. Yeah, good. Your inspectors, some of them have clearing agents, and we are aware. So they bring the products, they clear, they deliver, they sell. If you want names, come to MOH, I'll give you the names. That's why I did not come here 7 months. I wanted to collect data. I have data. And that data can also be provided by our security agents. Because the law is very clear, no product may remain on the market indefinitely without reassessment. The renewal process must continue. And it must be firmly, fairly, and strictly in accordance with the law. The illegal leasing of license must stop immediately. Leasing professional license to unqualified persons is unlawful and a serious breach of public trust. I'm sure the pharmacists around our country are listening to me. Does it happen or it doesn't? It happens. And I can give you the list of the pharmacists owned by people through leasing of license. So I therefore direct you to immediately intensify surveillance and stop this practice with immediate effect. It's against the law. Further, I'm also aware of the board decision on the bioequivalence for eligible products. And on this matter, let me emphasize, bioequivalence is not a favor. We will not negotiate it because it's a global regulatory standard that ensures generics perform like innovators and they protect patient safety. So board and the management, you have my full support to implement the bioequivalence roadmap that you have shared with me. To all our inspectors, any compromise, any neglect, or failure in your duties will result in administrative, disciplinary, and legal action on those individual basis. Our very good staff, you know, we are implementing a very robust, unique, transformative health agenda called universal health coverage. And what do we want to do in this universal health coverage? It has many, many players. We want to improve access to medicine, and also we want to upscale local manufacturing so that our people can get jobs, investors can come to our country. And you're also aware that regulators like Pharmacy and Poison Board, they serve a very important single point of truth for our sector-wide data. And for the Pharmacy and Poison Board, this means that being authoritative source of all matters related to product authorization, matters related to quality assurance and licensing undertaken must be done within the strict adherence of the law. And that's why, for this reason, Parliament enacted a law called Digital Health Act of 2023 that established the Digital Health Agency. And I think the CEO is here. I told him to be here. Engineer Anthony. What does the DHA do? DHA, what they do is they manage, they maintain, and they certify all systems across the health sector. From where he's sitting with his iPad, you can tell the bed occupancy in Kenyatta National Hospital as of this minute. From where he's sitting, he can tell how many Kenyans have registered under the SHA portal this morning. From where he's sitting, he can tell us the doctors who are performing surgery in many of our hospitals. So this digital superhighway is very critical for us. And in alignment with this mandate, the government, through the consortium led by Safaricom, they have digitized our whole care system, including all our regulators, meaning even the Pharmacy and Poison Board's regulatory function has been digitized. And to safeguard public resources and prevent duplication of procurement, the Ministry of Health agencies may procure or develop parallel digital systems outside the framework of this. So I have given instructions to all our agencies that all our information systems must flow, integrate with the digital health superhighway. Even now, the private sector hospitals are also integrating, so that we want to assure our citizens that patient safety is of paramount importance. So Pharmacy and Poison Board, therefore, under the Digital Health Agency, is expected to maximize the use of that digital superhighway to digitize all its core functions and operations. And these include several systems which are designed to support the Pharmacy and Poison Board end-to-end digitization. These include the National Logistic Management System and the Track and Trace System, where the drug given to the patient can be traced to the manufacturer, the licensing platform for all products and health services, the Quality Assurance Management System of Pharmacy and Poison Board. And to accelerate this process, the Pharmacy and Poison Board leadership should immediately establish a technical project team that will work closely with the Digital Health Agency. I know they had many meetings, but you now must have a technical team that will work together with Anthony and his team. And why do we need this? Just because we want to ensure that the implementation of this system are done within the Pharmacy and Poison Board not later than March next year. So I call upon the board and the management team and our staff to provide all the necessary support. The board to provide oversight and support to guarantee smooth transition during this implementation period. Your leadership is crucial to ensuring the Pharmacy and Poison Board become fully digital, fully transparent, and a very efficient regulator that will be proud of by Kenyans and in the region, and becomes a leader in the region, and help us build the public confidence in our healthcare system. We will do this if we do this, we will support the broader vision of universal health coverage. The Pharmacy and Poison Board plays a very central role in this transformation. Your decision will influence product quality, industry growth, and the confidence of our development partners like the World Bank. Our ministry values your work, and we will continue supporting you as we advance the health sector. And as I told the board and the management, these great people who are sitting here, these are Kenyans, and they are not here by mistake. Each and every staff in this place must be treated fairly. there should be no animal farm in this institution. Those who do very well must be motivated, they must be recognized, they must be promoted. Those who don't want to, promotion must be on merit. It's not who you know. As I told you, Chairman and the board, I will not call you to influence anything here. Neither will the President call you to influence anything here. So if you get a call from any other person, then that person is a cartel. Yeah. Kenyans must be protected. They have all their rights to work here. Those who don't want to work and they have discipline issues, they must be dealt with. But please make sure, from the people at the lowest cadre to the acting CEO, every Kenyan has a right to work in this place, and he must be appreciated, and he must be given all that he requires. That is the message I give to everybody in Nabila Fitina. If you have something very good, even come to my office. You know, I PS, you need to tell some of your directors. I am told that when people come to my office, wanasomewa, wanaambia mbona mmeenda kwa ofisi ya waziri. Every Kenyan working in the health sector and any other Kenyan, they have the right to come to my office. At an hour, they can come to my office without notifying the CEO. Yeah, the way the CEO comes to my office, the way the chairman comes to my office, they will also come to my office. Because I need a lot of data and information. So maybe they are coming to give me some data, some information that I can use in parliament, that I can use in the cabinet, that I can use it to advise the president. Am I right? Yes. I went to NQCL, and today I'm in Pharmacy and Poison Board. So we will find out, even if it means investing heavily, this place must become the best in Kenya and the best in our region. Yes. We have the men and women who can do that. We have the best human capital. What it was lacking is leadership. Am I right? Yeah, the problem in Kenya is leadership. I say it, and I will say it with confidence. The problem in Kenya is decision making. I tell PS Mudhoni and her team, and many even colleagues in cabinet, even saying no is a decision. Am I right? But if you keep that decision, you don't want to implement it, then una cause jam kwa hiyo the whole ecosystem. So don't cause jam. It should move. Somebody asked me yesterday, now after this, where do you want to? And he was a member of parliament from my region. Which other position do you want? I told him, my friend, what is wrong with you? There are young leaders coming, so I don't want to cause jam. So I must exit, the next exit in the highway. Left or right, you exit, then the others can move. Am I right? Even here, people must exit, whether it's by attrition, age, indiscipline, so that good officers, young officers who are delivering must get their place on the table. Everybody in life is dreaming. You know, you must dream. You must dream to be a director, a deputy director. You must dream to be the CEO of Pharmacies and Poison Board. You must dream to be the PS. You must dream to become the Minister for Health. You must dream to become the President of the Republic of Kenya. And all dreams are valid. So nobody should cause a jam. Ndio PS. Yeah, tutoke barabara. Watu waende, si ndio? Because why should you, some people can stuck, I'm told there are people who stuck in one grade for 10 years. No. Not right. It doesn't happen in the private sector. Yeah? It doesn't happen in the private sector. So, good staff, our staff, you're doing a wonderful. I'm happy with the lab. I've been to another lab. I can now grade you. I went to some other labs. Finally, to all our pharmacy and poison board staff, thank you very much. You are the guardians of the Kenyan pharmaceutical quality. Your efforts protect lives and uphold the constitutional right to health. But please, let's remain united in purpose, committed to excellence, and dedicated to safeguarding the well-being of every Kenyan. I really want to thank you, and I am very happy that I am the first minister who have come. You know, there are 23 ministers. If you go to Afia House, their photos are there. So you're telling me the 23 ministers, nobody has come here? Is that all the ministers of this administration? I need to find out if they are there, because even a very... All ministers. So the CIA is saying all ministers, including the man I admire a lot, was a minister and a president, Honorable Mwai Kibaki. He didn't come here. No. You guys, that's the only one. Neza kumtetea. I think you need to find out. Mwai Kibaki must have been here. But the rest, I don't know. But you know, it's wrong. You are my staff, am I right? How can the minister avoid here? And I'm sure ministers, they pass here. All the ministers of health, I'm sure one day they will used to pass here. So I'm here and I'll come back and make sure you do for them a Christmas party. And if I'm available, you can invite me. Just to pass by. Okay? And during the month of Ramadan, you make sure the Muslims also come together. Yeah. And when you invite them, you also invite their Christian brothers and sisters. That is the Kenya we want to build. Good people. Thank you very much for welcoming me. Count on me. We must build Kenya, but you must follow all the directives that I have said. Thank you, Chairman. Thank you, CEO. Thank you, all staff.